Hello judges, my name is Aleksandra Cholewinska and I am a senior at Juanita High School in Kirkland, Washington. In this video, I will be demonstrating how to insert a pacemaker as part of my clinical specialty project on cardiology. A pacemaker is a small electronic device that is connected to 1, 2, or 3 wires that are connected to the heart chambers. In my video, I will be demonstrating a single chamber pacemaker, which means it will have one wire that is connected to the atrium of the heart. While this is a minimally invasive procedure and in real life you are not able to see the full upper chest of the patient, in my video you will see both the internal and external views so that you can better understand the skill that I am performing. Let's begin. The first step is for the cardiologist to wash their hands for 5 minutes from their palms to their elbows. A long hand washing minimizes any chance of bacteria being transmitted to the body cavity. Meanwhile, the patient should be sedated, draped with sterile pads, and the area below the collarbone should be covered with an ioban patch by surgical assistants. Then, the cardiologist puts on a surgical gown and gloves to eliminate chance of infection. The gown is put on by a surgical assistant to avoid any chance of touching unsanitized equipment. Often, the cardiologist will wear 2 pairs of gloves to further maintain the sterile environment. The cardiologist should also have on goggles and a scrub cap. This protects their eyes from any fluids that may splash or spray up, and the cap prevents hair from falling into the body or into their eyes. The second step is to use an X-ray machine to locate the subclavian vein. This vein is located under the collarbone. Once the vein is located, we may proceed to the third step, which is using a black marker on the ioban patch that is covering the skin to identify where the incision will be made. Next, I will numb the skin with 100 milligrams of lidocaine. This is necessary because while the patient is under a sedative that helps them relax, they are still awake. The lidocaine anesthetizes the patient to make sure that they do not feel any part of the procedure. Now, I will use a scalpel to make a 2-inch incision and extend this incision down to the muscle, creating a pocket under the skin for the pacemaker. This is an extremely delicate step and must be done with precision. The greatest risks of a pacemaker insertion are bleeding from the incision site and pneumothorax, which means a collapsed lung that can occur if the nearby lung is accidentally punctured. I will then have to use clamps to hold the skin back so that I can better see the inside of the body. Since this is a minimally invasive procedure, that small incision is the only place where I am able to see the vein. My scrub nurse can help me with the clamps to ensure that I have the optimum angle and that the clamps are secure. Once the clamps are in place, I will use the suction tool to clear the area of unnecessary fluids. With the incision ready, I must now puncture the subclavian vein with a needle. A little blood might come up, and that is perfectly normal. My scrub nurse is assisting me in holding the needle still, so that I can carefully place the guide wire in the vein through the needle, and steer the guide wire to the atrium of the heart. This will be the path through which the lead wire will be inserted. The guide wire helps the cardiologist visualize this pathway. Once the guide wire is attached to the heart, I will carefully remove the needle and replace it with the sheath through which the leads will be inserted. Step 8 is to steer the pacing lead through the sheath into the atrium. The pacemaker stimulates the heart with electrical pulses that pace your heart if it beats too slowly, and these pulses travel through the lead wires. Now, I will take the stylet, which is a piece of thin, stiff wire that will lock the lead into place, and I will guide it through the lead all the way to the heart. I place the lead into the muscle using X-rays to control the position, and then I remove the stylet. After attaching the lead to the heart muscle, I must confirm with the pacing monitor that the pacemaker leads are working and that the heartbeat is steady. A healthy heart has 60 to 100 beats per minute, and I have to make sure that this is what the patient's heart is going at. In the little picture, you can see how the leads look in the heart of the atrium. After I have successfully checked the heart rhythm, I can remove the sheath. I will now attach the lead to the actual pacemaker and place the pacemaker into the pocket under the skin. The pacemaker goes on the non-dominant side of a person's chest, so if the patient is right-handed, the device will be placed in their upper left chest, and if they are left-handed, the device will be placed in their upper right chest. The last step is to suture the incision. There should not be many sutures, as this is a small incision. When I am finished suturing, I will place a sterile dressing over the area to keep it away from infection and to help it heal. After the procedure, the patient will be taken to the recovery room and kept at the hospital for overnight observation. If everything is working as planned, they will be ready to go home the next day. Most pacemaker batteries last 6 to 10 years. The patient will have to come in to have their battery replaced, but they will also have to visit the cardiologist periodically, even before then, for regular heart checkups. Alright, that is the end of my video on how to insert a pacemaker. Thank you for watching and have a great day.